David, thank you very much for joining me. I know that something that really concerns you in this area is long waiting lists for treatment. But is it not just simply the case that we don't have enough mental health care treatment?
Not at all, no. One of the really frustrating areas with the mental health waiting lists is that we know that whilst people are sat waiting on the list to be seen, they're actually getting worse. This isn't like sitting on a waiting list going to see a bank manager or waiting for the cinema or something like that. People deteriorate, people become poorlier while they're on the waiting lists. We have many people that call our information line, and they will call repeatedly, and we get to know them on our information line. They may have been told that it's going to be 12 months, 18 months before they can actually see a therapist. And during that time, we often get to see how their lives begin to fall apart. They become more and more anxious, more and more stressed. That will affect their employment, their relationships, their ability to manage money. They become poorly, so that by the time they get to see the therapist, they're actually in a much worse position than they were when they first started out.
How big a problem is this then?
It's huge, and it's growing. We do know that 1 in 4 people will experience a mental health difficulty at any point in a year. We also know that the interventions, the treatments that we can offer really do work. And this is another one of the frustrations. Over the last 20 years, the medicine, the drugs that have become available for people living with severe and enduring mental health difficulties have become so much better. We also know that talking therapies, counselling, mentoring, psychology, the evidence base for those has grown phenomenally, and we now know that they're really effective and really cheap ways of helping people recover from common mental health conditions.
You say they're financially effective, cost effective. How cost effective? How much are we losing out by not getting people treatment earlier?
Yeah, there's some really stark figures that we could look at. If we look at the overall, they call it the burden of disease within the NHS. So it's the percentage of different illnesses within the NHS. And mental health accounts for around about a quarter of illnesses within our health service. Yet it's only receiving about 11% of funding within the health service. That's a huge gap. And what we do know is that that's actually getting worse as the years go by. There's a big campaign at the moment. You may have heard the phrase around parity of esteem. It's a bit of a jargony word, but that's around trying to balance out that difference between mental health care and physical health care. And one of the best examples I can think of for how this actually affects us in practice is, at the moment, you may be told that you need to wait 6 months, 12 months, 18 months if you've got a mental health condition. Could you imagine if you turned up at accident and emergency with a broken leg and being told there that you needed to wait 6 months, 12 months, 18 months for treatment? There'd be an outcry, people will be out on the streets, and we need to raise the awareness about what's happening in mental health right now.
David, thank you very much indeed.
Thank you.